We start with so
Okay.
welcome Dr. Bacherini. I'm here with Dr. Bacherini today to discuss a little bit about the Congress, Awesome Aesthetics by Hofmeester, which will be held in May. And as I was getting to know Dr. Bacherini a little bit more, I discovered that you actually were first a dental technician and then you became a dentist. That's correct, right?
Yeah, it's very interesting for me to underline this aspect because when we speak about digital dentistry, when we speak about aesthetic dentistry, minimal invasive dentistry is very important for the clinician to understand very well some technical aspect of the lab work. Doing that, we can optimize everything, meaning that when you start with the perfect walks-up, with an optimal walks-up, you can optimize also the tooth preparation. Everything starts from the walks-up, from the lab work.
I totally agree. Totally agree. And it seems to
I would like
be
to emphasize this concept. No, if you know well how to optimize a walks up, and most of the time I do by myself the walks up. You have perfect in mind how to control the preparation, how to optimize the preparation.
yeah, probably you already visualize the preparation when you do the wax up, right? And I mean, that's so much of a value when you are doing it in the mouth. I mean, you have already done it outside the mouth, more or less. So yeah.
And also in digital dentistry, because one of the advantages of the digital dentistry is the use of the STL derived from the natural shape, no, from the library in which you can find the natural shape. But if you cannot how to say, match the natural shape with the initial situation, respecting some basic rules of aesthetics, so the position of the transitional line angle, the volume of the tooth at the cervical area, you cannot optimize the wax up and the tooth preparation. So also in the digital dentistry, it's very important to keep in mind this concept.
Yeah, of course. Well, it seems when I think of it, all the dentists that actually I know of that are both a dentist and a dental technician, those are like the best dentists ever that I've met. So, I mean, I can see that the knowledge that you achieved when being a dental technician, I mean, it's so much, you're so far ahead of the rest when doing your preparations. I mean, and I've been looking at your preparations. I've seen some pictures and they look so well, the margin is so very thin defined. Do you sometimes even let the dental technician more or less decide where to end? So do you say knife edge? Do you do that as well, or?
That's a good question, because most of the time the preparation is at knife edge, just roughening the surface of the tooth.
Yeah.
So that's why I don't like to polish, for example, because you leave the signs of the burr and then you communicate to the technician where the finishing line is. Because sometimes it's very critical because it's almost a flat surface, no? So there's no other way to communicate to the technician where the finishing line is. That is the point, no? Just leaving the signs of the burr, sometimes. And so it's very delicate process, so.
Yeah, for sure. Yeah. And you then, because with digital dentistry, you try to optimize your preparations for your digital dentistry, and then you take into account like your drilling compensation, so the space that you need for the CAD/CAM machine for the drilling. But are there any other aspects that you think are very, very important to take into account?
one of the most important aspects that we have to consider is the position of the finishing line. It means that sometimes the finishing line is really close to an adjacent teeth that with the intraoral scanner is not so easy to define. Sometimes the STL is confused.
Yeah.
So that's why you have to position very well the finishing line. Sometimes you have to work with some strips in the interproximal area to clean very well. So some little tips and tricks that I will explain during my presentation to optimize this important phase of the process of the treatment, the definition of the finishing line in minimal invasive dentistry with an intraoral scanner.
Yeah, I really like that. I have that problem actually quite a lot myself, that it seems to blur a little bit in those very sharp, tiny spaces, and yeah, that would be very welcome to have some tips and tricks for that. Yeah, of course. And what would you could you maybe go a little bit into what kind of materials do you mill, or what kind of materials do you prefer to use in the anteriors for digital dentistry?
Today I like very much Empress because it's not so easy to mill, but it's easy to have a very natural appearance. Not on the picture most of the time, but in the reality. Because, for example, Emax is better on picture, but worse in the reality, no?
No, we treat patients, right? Not pictures. So that, yeah.
Problem. Sometimes we show some fantastic picture, but in reality, the appearance is sometimes too gray. It's not so, how to say, with a high value, because the problem is the control of the value with this kind of ceramic, mainly with the Emax. So that's why today I like to use a multi-layer Empress. B1 is a very nice color that we show in some cases. I like very much. Obviously, we have to consider the patients. It means that sometimes you treat a Braxer, so you have to be really careful in selecting the appropriate material and to control the load, the stress on the incisor margin. So again, in my presentation, I will explain also some basic concept treating challenging patients, means Braxer.
Okay. And then you might choose another material than Empress, for example, or
sometimes I try to mix different material on the anterior, the posterior. Now I'm trying also to use the zirconia, for example, for tabletop and the posterior. So sometimes I like to mix 3 different materials: zirconia in the molar, Empress in the premolar, Emax in the premolar, and Empress on the anterior. But consider very well the anterior relationship. It means the overbite of the overjet, the presence of bruxism, also different consideration.
It makes a lot of sense there. If you would drill the Empress, would you do then a cutback, or would you do something like a stain a tint technique, or
monolithic? The future is monolithic,
sure.
Also because it's very, how to say, chameleontic, we can say. I don't know if it's correct to say that, but it's very nice material, also sometimes without any stain. So that's why it's very easy to use and amazing the final aspects. Cool. Monolithic, for sure.
And we're gonna do some hands-on, right? We're gonna during the day we're gonna have the hands-on. And what do you have in mind? We do some preparations of the anteriors, and you show us how to do that in a minimal invasive way.
Yeah, for sure. I will show you to the group, to the dentist, how to select the burr, which kind of burr, how to use the burr, how to design the finishing line, different situations. So we will try to prepare for back veneer, for full veneer, and
Okay.
also for V veneer, different kind of preparation. Yeah.
Is it mean that you connect like the palatal and the buckle
and the buckle, yeah.
That's interesting.
I'm touching the interproximal area, so it's very, very conservative design. Little bit difficult in some phases of the treatment, in the cementation. So I will show you also how to control everything in different moment of the rehabilitation.
Wow, amazing. And of course a little bit more about, because I saw on your website, I saw you have a beautiful practice in Florence. But maybe can you tell me a little bit more about what you I mean, dentistry, it's for probably for both of us, dentistry is like a big part of our lives. But what is there more, what is Leonardo Bacherini more than dentistry, of course, but I would like to know some other things. What are maybe your hobbies, or do you have a family?
Yeah, I like very much sports, to every kind of sports. So now, because I have no time, I like to run and to
Yeah, that's
enjoy
efficient, right? Running is efficient.
my countryside, because I live in the country. I have a little farm, so I like to take care of my house, my plants, everything. So, but I'm obviously really busy in my office and with Dr. Fradiani, because almost every weekend we have a course. So I try to find a balance between everything and family also. So it's not so easy, as you know.
No, it's difficult. Yeah.
And now I'm really excited because I'm creating my lab. I'm probably starting new activity as a dental technician, as a digital dental technician. I have a very young technician with me, and I'm trying to arrive at the excellent level with the digital dentistry with a very simple procedure. Is exciting for me today in my office.
Yeah, because I think we are taking steps for digital dentistry, but for me in my, if I look at my practice, I have a scanner and but the work that I do, if it is a case and my patient wants me to do it like very good, then I go analog again, because then my dental technician, the dental technicians then that I work with, they do analog, and they say, oh, I don't feel comfortable with digital, so I'm more or less waiting for the dental technician to do its part digitally. If you are, I think that's
the idea is to train very well my young dental technician, and to again to cover all the aspect of the restorative dentistry. It means sometimes also big rehabilitation on implants. So it's very exciting because every day I discover a new application of digital dentistry, and every day I can fix a problem that I have in my daily practice with the digital, because digital dentistry is not only a digital scanner, intraoral scanner. No, it's not complex. It's very, how to say, complete system that allows you to do everything. Yes, so that is exciting to be able today to do everything with digital, everything. But again, you have to have a very good technician able to think digital.
Yeah, exactly. And not print the models and then put them in a Facebook and then scan them again. No. No, I see what you mean.
So we are also, yeah, we are also testing new devices that are now becoming very popular, like the jaw motion tracking.
Yeah, the module.
Mojo is one of them,
okay.
But also SDI Matrix, also
Yeah.
others. So we are
Yep.
testing the real value of this kind of devices. Yeah.
Yeah,
It's
that's amazing.
another part of digital dentistry. Yeah. If you
Yeah.
want, I can show you also some aspects of that, but I don't know if you will have time because the
Yeah. No.
about preparation and
Yeah. Well, it would be
that.
very interesting. I think there is like there is still, as you probably noticed yourself, there is still a huge gap in between, because actually, well, digital dentistry is not really in my hands as a dentist. It's exactly as what you say. It's in the hand of the dental technician. And his job will change dramatically when doing it digital. My job is just by holding the scanner and not the impression material. I mean, that's not such big of a deal. So yeah, I think, at least in our country, dental technicians, they can use some help, and probably some help from you as well. So so the second invitation is then already here, you know.
Yeah, the idea is again to prepare my technician to be able in the future to do some courses specifically for this kind of figure, that the new figure in a dental office, a digital technician.
Yeah, I totally agree there. I totally agree. Yeah. Maybe some another question, of course, that I would like to ask you is, why should the Dutch dentists come to Awesome Aesthetics and do your hands-on? What would be their benefit? So why would you or let's say, how would you invite the dentists from the Netherlands to your lecture or to your hands-on? Okay, so why should the dentist attend your lecture and hands-on?
Because we have a very interesting topic to discuss with you, because sometimes I like to also to learn from the participants. So I think that it will be a very interactive session which we can discuss the past and the future of dentistry. That's why it will be a very exciting session. And then also we have the chance also to go deep inside the topic of the tooth preparation, but tooth preparation is only one part of the rehabilitation of the mouth. So I think that will be a very rich discussion session.
Yeah, and I think it will be amazing to see the knowledge of you, Dr. Bacherini, of combining both your vision as a dental technician and your vision as a dentist to show us the best recipes on how to be successful with the anterior preparations. So thanks a lot, and I'm really looking forward. I want to thank you for your time to do this chat with me, and we are really looking forward to welcome you to the Netherlands. Have you actually ever been to the Netherlands before?
Yes, many years ago. It will be really a pleasure to come again to see Rotterdam. I would like to go also to Amsterdam again. So occasion to see you again.
Okay, perfect. Okay, we were looking forward, and we see you then in May. All the best, and well, we let's make something nice out of it. Looking forward to that. Okay, I will stop the recording.